What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. You can email me, drmo@digitalnomadphysician.com. So I'm recording this now, second day post-op, had surgery on the hand, and I think in this video it'd be good for me to talk about the entire patient experience, the patient journey, and what the healthcare system here is like in Spain compared to what we're kind of accustomed to in the US. And some of the things I learned along the way, especially talking to the physicians, talking to the nurses, navigating everything, it's been a great journey. It's been a very enlightening journey in some ways. And I think for me as a physician, trying to kind of figure out where do I belong in the system, what is it that I want to do, what is it that I want to achieve, I think it's all going to be a great, in the end, once I look back on it, I'm going to learn a lot. So let me kind of take you through the clinical aspect of it for you physicians, and then I'll take you through the entire experience as a patient, and then I'll take you through the experience and kind of commentary that I have, what it's like for me as a physician to think about, what my patient is going through and what it's like to be that physician or patient in the US versus here in Spain. So this all started out with a small little mass in the palm of the hand on the kind of the radial side, the ulnar side. And I've been a rock climber, and this mass kind of started developing. I went and talked to a physical therapist who recommended some exercises, but the mass kind of grew a little bit. And every time I would exercise, I would get a lot of swelling and effusion in the bursa of the hand, and to the point that it would compress my median nerve, it would compress my ulnar nerve, and so I would get a lot of numbness. So I went to a traumatologo, which is basically an orthopedic doctor in Santiago de Compostela. And he said, well, it's probably nothing that bad. Let's go ahead, because it's been there for so long. This is now probably started about 3 years ago when I started with that small mass, but it was really never a big issue until maybe just the last year when it started getting painful. I would wake up at night, I would get numbness. And so the orthopedist said, let's go ahead and get an ultrasound of this and do some nerve conduction studies because I was getting the numbness. So the nerve conduction studies showed just a little bit of a median nerve issue, a very slight amount of radial nerve problems, and some C6 nerve issues as well. Nothing really major, and I've always had some ulnar neuropathy or cubital tunnel syndrome, so a little bit of issues there too. And the ultrasound that they did of the hand showed just some bursitis, which actually ends up being correct, but we'll get into that in a minute. So the problem kept being there. So I talked to this surgeon, and he said, nope, no surgery needed, just do physical therapy stretches. So I went back to my physical therapist, and really no improvement. If anything, it got worse, especially with climbing. And then I stopped climbing, probably 6 months, maybe 4 months, I don't know, and no improvement. If anything, it got worse because I couldn't hold the knife that well. It would give me a lot of shooting pain and sensations. And so I went back to a different orthopedist. I went back to the first orthopedist. All of them sort of had the same story. Nope, no imaging needed, no MRI, nothing else needed. So I said, you know what, let me go to somebody who's only a hand surgeon, which wasn't easy to find in my area in Santiago de Compostela. So I ended up looking for someone in Madrid. And in Madrid, I found Dr. Piñal, who was highly recommended. And I went to Dr. Piñal, and as soon as he saw my hand, he did the Allen test, and he basically discovered there that I had lack of blood flow. And so he said it's got to be a arterial thrombosis of the ulnar artery. And so he recommended a CT angiogram, which I went and did. He also recommended a MRI of the wrist because I had some issues with the wrist as well. But anyway, so I went and did the CT angio, was negative, so his diagnosis was incorrect, and his bedside manner was good. It was a very good bedside manner, but it was kind of immediately, this is what it is, and we're going to take an artery graft out, and we're going to do an arterial graft. That's what you need done, period, end of story, not contemplating any other possibilities. And so that kind of put me off a little bit, and I lost faith in him, especially because the CT angio was negative. He didn't order an MRI of the hand and only the wrist. And so anyway, I went to a different surgeon, Dr. Roger de Oña, and Dr. Rogers, what they call him, because he did some of his studies in the US, and he sort of sat down with me, really took his time. My girlfriend went with me, made a lot of eye contact with my girlfriend. One of the things we've noticed here in Spain is that some of the men, they don't make a lot of eye contact with like some of the male doctors don't make a lot of eye contact with the with women, and so it's kind of odd. It's kind of, I don't know if that happens in the US, but it's something that me and her have noticed here. He made a lot of eye contact, and it was great having my girlfriend there because, it was like a really good discussion overall. Like, what could this be? He did a really thorough exam. He examined everything, and kind of like said, yeah, I don't think it's anything vascular. It sounds like it could be just the bursa, but we really need to get an MRI of the hand. Like, without an MRI, there's nothing we can do. So again, these were all, the majority of the primary visits were insurance-based. So I just paid like $60 a month for my insurance. So I went to those insurance doctors, and so I didn't have to pay anything else. But then Dr. Piñal, who is in Madrid, I paid 200 euros for one visit with him, and it was probably just about 20 minutes, 15 minutes. And then Dr. Roger Oña, his visit was $250, and he spent probably almost 30 minutes with me and said, okay, you really need to get that MRI. So I went back to the original doctor because I didn't want to, I ended up paying cash for the CT angio, and I wanted one of these original doctors to hopefully order the MRI. And so if they ordered the MRI, I wouldn't have to pay for it. So I did that. Then you have to get an authorization. So I had to go to the office for my insurance, and yet I had to get that. And I'll get into that in a little bit about the process of the healthcare system here. And this might be painful for some of you who are watching this who are not doctors, but again, this channel is really for my physician audience. I really want to dive into this well enough that it's understood. This was a complex issue. This really was not a straightforward issue. Me and my girlfriend couldn't make sense of it. We really believed it could be vascular, certainly could be something nerve-related, certainly could have been just a bursa. But I also developed some lymphangiitis here, which we're still kind of trying to figure out. Like, I have this little line here, which is complicated to figure out even for my doctor. But finally, I took the result of the MRI, and it showed basically a really large inflamed bursa inside here. And obviously, this carpal tunnel was a big problem as well because my median nerve was getting compressed. So I finally went back to Dr. Roger Oña, and he said, look, if this wasn't so big, maybe we could consider doing steroid injections in there, but it is so big and you got this lymph issue here, it could be like a odd bacterial infection, so we consider like a mycobacterial infection, kind of like a chronic low-lying bacterial, fungal, whatever infection. It could be still a malignancy of tumor of some sort. And so he really needed to go in and do an open carpal tunnel surgery, not like a orthoscopic. And so he went in. So that was the surgery that was planned. So I got admitted to the hospital in the morning. I went into the OR, and he basically did the carpal tunnel resection, but he ended up having to open it all the way from here, down to about here. So very large, with a big drain that he had to place here for the surgery because it was much bigger than he anticipated once he went in. And this is day 2 post-op, and I still got quite a lot of numbness of the ulnar distribution, and that's probably expected because of such an extensive surgery. He did release the carpal tunnel, and so I gotta keep that kind of gentle. That's why there's so much dressing on here. The drain is now removed. I had about a 50 cc output from that, and I would say it's a little bit of pain, but we'll get into the pain control stuff in a minute. Basically, just he recommended, just ibuprofen and Tylenol. And so now I'm waiting to go follow up. Today is Monday. So tomorrow I had my surgery on, let's see. Oh yeah, I don't have my surgery. I had my surgery on Friday. Saturday I stayed in the hospital. Sunday, that was yesterday. Oh yeah, and today's so actually almost 4th day post-op. So I go and see him on Tuesday, which is tomorrow. And then I think he's going to take the dressing off. The sutures are going to stay in. And usually it's pretty straightforward with any kind of carpal tunnel surgery. You keep the wrist immobilized for 2 weeks, and then after that you begin pretty extensive physical therapy. But I do have to start a good amount of physical therapy for the fingers because I also had the synovectomy of the hand. He didn't have to remove any of the tendon sheath, only the bursa, I believe was how he described it. So I should be able to go back to climbing if the other stuff is okay and if I heal without complications. So what they did post-op is they gave me some blocks here, so my entire hand was numb and couldn't move it at all. I had no function of the motor nerve, and that was really good because I had no pain or discomfort for that first probably 24 hours. It was amazing. And then I had the hospital stay. Okay, so that's kind of the clinical aspect of this. Still got to wait weeks to get microbiology reports back. Got to wait probably a week or two to get pathology reports back, and it's going to be a long, extensive kind of physical therapy. I expect about 6 to 8 weeks of physical therapy before I can kind of get back into any kind of climbing or cutting, cooking and stuff like that, or doing any kind of work around the house. As far as the experience from a patient and a physician in the healthcare system, so I thought the insurance model that Spain has, which is very cheap, right? In the US, you pay about $400, $500 a month for health insurance, and you still have somewhere around $8,000 a year of out-of-pocket expenses that you may have to come up with. And so that's kind of the downside. Like it's a lot of money that you have to pay. And if you went to go do this cash, each one of my visits probably would have been $400, $500. Any one of those imaging studies would have been $500. So if here in Spain, the visits, there's no copay, I have to pay nothing. Like my insurance is full coverage at $60, $70 a month, whatever it is. It goes up obviously year to year. The downside is the surgeons, the doctors who kind of accept this insurance system aren't always the best. And the reason for that is they get reimbursed at such a low rate. And some of them told us, like for physical therapy, they get $5, $6 for each physical therapy visit. When normally they charge $30, $35 cash. The doctors who charge maybe $50 cash for a visit are only getting maybe $10 for a visit. And it's even worse. Some of them who would normally charge $90 are getting maybe $12 a visit. And so it's understandable that these people are doing it for the volume and the fact that the insurance company is going to send a lot of people their way. And probably a lot of the patients are worried well, and so there's not a lot of things to do. A lot of the doctors are retired, or they have their own private practice on the side, or they work for the public system. So then you got the public doctors. For the most part, all my friends in Spain are very happy with the public system. There is a long wait. You do wait a long time, but they're very happy with the system. They say most of the doctors are really good. They have good experiences. They get plenty of time with the doctors. Good. Then you got this middle part here, which is this insurance system. And I think it's for the most part for the patients who just don't want to wait too long, or for gringos like myself, right, who need access. I can't go to the public system whatsoever. I can't make any use of that. I have to go in this private model. And then over here, this other end, a very small end, you got the doctors who are only taking cash. So my surgeon did everything by cash. So let's put Dr. Pinal aside, because from what I hear, he's a great surgeon, absolutely brilliant in his technique. But again, that entire jumping to a conclusion, he had 2 other students with him, and sort of not really contemplating other things. For me, even as a physician, it's sort of, it's not something that's easy for me to understand. Like, you don't go to a CT angiogram if you haven't exhausted other things, or you don't put all your eggs in one basket. But me and my girlfriend were talking about this, and she had a good point. If he's worried about an arterial thrombosis, and the thrombosis could throw off other emboli, and he's worried about you getting a gangrenous digit, he's going to go to that CT angio. That's the most important thing. So she has a very good point, and I don't think I really understood that until she kind of explained it to me. But again, for whatever reason, I felt more comfortable going to Dr. Roger Doña and having him be really thorough and consider all the other options and really go to that MRI of the hand. And so I ended up paying $250 for Dr. Roger, and then another $200 for a follow-up visit. And then I ended up paying €8,000 euros for the surgery itself. That included only the surgery. So he's going to take some of that money and probably pay for a surgical assistant, another surgeon. She was there as well, and she actually came and rounded on me. And then I paid 3,800 euros to the hospital, which included my anesthesia. So that included the block. I ended up having just some conscious sedation and Valium, sublingual, and of course, Dr. Roger just did mostly local, like infiltrated the median nerve, etc. And then some pain follow-up. Then they brought me food in the hospital. The nurses came and checked on me. And Dr. Roger Doña, he came and rounded on me the first day after the surgery, I believe. And I don't remember all the details. And then the second day, his surgeon, his assistant also, well, she's a surgeon, but she came and actually unwrapped everything, took the drain out, gave me some instructions on exercise, what I should do, what I shouldn't do. It was really great. And she was actually a little bit more thorough even than Dr. Roger. So just a great experience overall. The hospital thing was kind of like your classic hospital thing, like the nurse is like, no, you can't hold this here. You can't let the vacuum tube be below the level of be above the level of the hand and stuff like that. But they were very, very nice, and came and checked my blood pressure. They woke me up at night to check my blood pressure, to check my temperature, standard stuff. They came and offered me pain medications, which I think were just anti-inflammatories. There was no opioids as far as I know. And I kind of refused it, but then both my girlfriend and the assistant, the surgeon, they recommended, just for the nerve's sake, I should be on some anti-inflammatory. So I've been taking some dextromethorphan, I think, I don't know, some NSAID every 8 hours. And I'm going to take that until I see Dr. Onya tomorrow, Dr. Roger Onya tomorrow. So the experience in the hospital was okay. And I think that $3,800 that I'm paying is for the hospital stay and the anesthesia. The $8,000 is for the surgery. That part, I think the price is unbeatable. Compare that to the US. For a hand surgeon, I probably would be looking at somewhere, if I were to pay cash, a hand surgeon probably is going to charge me somewhere about $450 to $800 for that initial visit. Follow-up might be somewhere around $400 to $500. And if I were to do that surgery cash, I suspect, and again, there is going to be a lot more people involved in the operating room in the US versus here in Spain, I probably would be looking at paying the hospital fee of $10,000, $15,000 and paying a surgical fee of $30,000 to $50,000, because the surgeon may have to go in and they may uncover something problematic. Even my surgeon said, hey, if it becomes something like a microsurgery that I have to go in and perform microsurgery, it's going to cost you more. And he mentioned something along the lines of like, it's probably going to be somewhere between 10 to 20,000, no way more than 20,000 euros. And he even said that in the US, it would be probably comparable to the upwards of 50,000. And I think that's about right if you were going to pay cash for this. Now, I think you're going to find surgeons in the US, hand surgeon, hand specialists, who can really identify what the problem is and anticipate it and really have the system of cash down so well that they can say, look, we're going to get the MRI, we're going to get you the follow-up, we're going to have the anesthesia in the room, we're going to do it we're not going to do it in the hospital, we're going to do it in a surgical suite, and then we're going to have you follow up with me instead of stay in the hospital. It's going to save you a lot. I mean, just that alone probably is going to save you $10K, in the US. And Dr. Roger really recommended that I stay in the hospital. He's like, because I think it's just safer, if I need to control your pain. They don't give opioids unless you're in the hospital. That was one thing that he taught us. And I think that's something important for us to understand as physicians and patients who come from the US system. I don't get any opioids. I don't get Percocet, Tylenol with codeine, Vicodin, Norco, nothing, Oxycontin, nothing. And so all of this is controlled. And this is a very, there's a big surgery, open it all the way. You have to pull tissue out from here, rip tissue out from there, and a very extensive, and hands, it's a very sensitive area. But I understand the problems, and I think that's why the opioid crisis is not as big of an issue here in Spain versus the US. And so he mentioned that if you have severe pain or if you have a complication like a hematoma inside, I'll be in the hospital, he can take me right back to the OR. And that makes sense to me, as opposed to then readmitting me and then doing another surgery, charging me for another stuff. I think it made more sense to monitor me closely because it wasn't that cost prohibitive. But in the US, again, I think if you're paying a surgeon who's really well-versed and knows what to anticipate and knows that he or she's probably not going to have to do anything microvascular, vessel anastomosis or anything like that, then chances are they're going to charge you somewhere around $25,000, $20,000, $30,000. It may not even get that high as $50,000. And they've done this long enough that they know what to expect, what to anticipate. So I think that's the difference of finding a physician or a surgeon who's not only cash-based, but also knows how to handle that patient journey when it comes to cash, right? Knowing that, like, hey, if this patient has to be readmitted, all of a sudden they're going to incur this huge cost. How can we prevent this readmission? Can we bring them back to the surgery center? Can we bring them back to the outpatient? Can I keep some open appointments available to see this guy? Does he have a low-grade fever? Is it something that I can open locally in the office and then just drain it again and put him on IV antibiotics and put them on oral antibiotics? If your surgeon doesn't know that and you're going to go to a surgeon who's mostly insurance-based and hospital-affiliated, and you're like, oh, I'm just going to pay cash for this, all of a sudden your costs could be horrendous if you develop any complications. And so I think that's something important to keep in mind. And I will say that some of the things that were probably a little bit difficult for me was the language barrier. If Dr. Roger and Dr. Pinal didn't speak English, it would be a disaster. So fortunately, they both spoke English. And so it was a really good experience for me overall because I was able to communicate with them in English. Now with the nurses and some of the other people, we were able to communicate in Spanish, but even then it was not quite as easy. So some of the other things were just, like the hospital admission. The hospital bed was amazing. The hospital room was completely private with a closet and a big bathroom, patio, big open windows, air conditioning in the room. It was literally like a nice hotel, So in that sense, it was good. And for the amount you pay, again, and for the service you get, for the experience these doctors have, and the lack of fear that they have, I think that's important. I will say that these doctors here, they're very nonchalant. They talk to you very openly, very frankly. He was telling me what his plans were. He's like, I can't run on you tomorrow because I'm going skydiving. And these are the things that I cherish as a patient, because it's that humbleness and that just being open, about who he is and what he's like and what his personal life is very valuable to me, as opposed to the US, where you kind of have this distance between the patient and the doctor. So those are also differences. But I will say that even though this was a cash-based experience, I still thought it was lacking a lot in the entire patient journey aspect, meaning I just really needed to deal with one doctor. I just wanted to deal with one bank account. I just wanted to deal with one thing. And I think if Dr. Roger de Oña, Dr. Roger, really wanted this to be a very smooth cash experience, I think he probably would have done things differently, especially if he was in the US. I think his entire office would have handled all of the billing, all of the admission, all of the, what kind of food do you want? Like, for example, I don't eat lactose and anything like that. And I think if I went to the hospital, they just kept bringing me milk. And so that's stuff that I would have figured out ahead of time. Or I had to bring a bunch of paperwork myself to the nurse. The nurse is like, did you print these papers out? And I'm like, no. And I had to do that. So then I had to email it to them in the hospital, because it was instructions, which I think I get it. Like in Spain, it's sort of the patient's responsibility of a lot of stuff. Like every visit that I had to go to, I always had to take my MRI, CT report, and blood tests. When in the US, it's really the other way. I, as a doctor, not only am I the one who handles all that, but I'm responsible for it. Even if you got an MRI and you never read it, it would be my responsibility. I would be at fault as a physician in the US. And I think understanding that system, the difference, and taking that responsibility is something I'm not accustomed to. And here in Spain, I'm kind of learning that. And it's both good and it's a little bit of a hurdle for me to overcome. But I think, again, if you're going to be a doctor here in Spain, there is such a huge opportunity to make that entire experience such a better patient journey, and not only charging more. I think charging $8,000 for a surgery for Dr. Oña, that seems on the low side to me, because a lot of his patients are probably not going to be traditional Spanish people who work in the Spanish system. It's probably going to be a lot of people, because if you pay cash, right, there's a reason you're paying cash. So it's either going to be really rich people of Spain, or it's going to be a lot of rich people in nearby outside of Spain, or who are living here currently, who have the means, who have the wealth. And so I'm not saying that he should charge more, but I think charging more and making that system more integrated, so that it's just one person, one aspect, one thing that the patient is dealing with, and having that accessibility for the patient and getting those studies done and getting involved is valuable, is worth it. Again, so this is my experience. The takeaway I will have, if you're a patient if you're an American, you come to the US Spanish system, I think it's good to get second opinions. I think it's good to get multiple opinions. And I think one thing that we do amazingly well in the US, which honestly, amazingly well, is that we immediately, when the exam and the diagnosis is not very clear, we do go to the highest yield tests with the least amount of side effects first. For example, in this case, I got a CT angiogram. Well, I did get an ultrasound first, actually. And that's the funny part. The ultrasound was correct. This ended up being basically a large cyst. But it didn't give the whole picture, right? No way a surgeon could plan his or her surgical route based on that ultrasound alone. And so we would really get that MRI first in the US. And we probably would leave the CT angio unless we did some Doppler studies or we had some other reason to believe that there is a vascular compromise. And I think that's something that's maybe a little bit different here. Pain control, yeah, that's something to consider. If you're accustomed to getting like Percocet, oxycodone, or something like that for pain control, that's something that probably is not going to happen here, but you can get admitted to the hospital and have that pain control done through IV opioids. So that's an option, but they're probably not going to give it to you outpatient. And then the communication gap, like if your Spanish is not that good, and you need to find a surgeon who can communicate with a language that you can. Now you could bring a translator, but I think to me, when as a doctor, when I work with translators, it's never the same. That connection is not there. I don't really understand things, and there is that gap. So for those reasons, I think it's always best to really try to find somebody who can, at least you can throw in a little bit of Spanish, they can throw in a little bit of English, and overall, hopefully it's going to go well. So if you have any questions about the entire healthcare system here, or if you have any questions about the healthcare system in the US, or you have any comments about how things could be really different, for the physicians who are watching this, especially for those of you who are really interested in doing something on your own, creating something private, these second opinion things that I keep talking about are so invaluable. If I could just find one surgeon in the US who was willing to see me, all of them said, no, you have to be located in our state, which makes absolutely no sense. You can still give me your clinical opinion based on my findings, based on my results, without engaging without entering a patient-doctor relationship. I would have been much more comfortable doing that, and I could have still taken your recommendations, brought it back to a surgeon here in Spain, and still had the surgery performed. So I think it's a valuable option that we need to start offering for people. If you have any questions, email me, drmo@digitalnomadphysician.com. Take care.